Liver cancer, once a rare and primarily alcohol or hepatitis-driven disease, is now surging globally at a pace that alarms oncologists and public health experts alike. What's fueling this sudden rise? A silent, slow-moving condition closely tied to obesity, non-alcoholic fatty liver disease, NEFLD. Largely overlooked in obesity conversations, NEFLD is emerging as a primary driver of hepatocellular carcinoma, HCC, the most common and deadly form of liver cancer. This dangerous trend is unfolding with minimal public awareness, inadequate screening protocols, and dangerously delayed responses from health systems. NEFLD, now the most common liver disorder worldwide, affects roughly 25 to 30% of the global population, and in some high-income countries, prevalence exceeds 40%. It begins innocuously, the accumulation of fat in liver cells not due to alcohol. But over time, this fat infiltration can lead to non-alcoholic steatohepatitis, NASH, a far more severe inflammatory condition. NASH progresses in many cases to fibrosis, cirrhosis, and eventually liver cancer. Critically, this cancer can develop even without cirrhosis, making early detection more difficult and traditional screening criteria less reliable. Obesity plays a central role in this progression. It drives insulin resistance, promotes chronic inflammation, and alters lipid metabolism, all of which converge to accelerate liver damage. Visceral fat, in particular, is a potent source of inflammatory mediators and free fatty acids, which flood the liver, promote oxidative stress, and damage hepatocytes. As liver cells attempt to regenerate, the risk of DNA mutations and malignant transformation rises. It's a biological cascade that takes years to unfold, but its seeds are planted in obesity early on. This pathway is more dangerous than many realize. NAFLD-related liver cancer often presents without warning, with no preceding symptoms, and in people who may not drink alcohol or have any history of viral hepatitis. Patients are frequently diagnosed at advanced stages, where curative options are limited and 5-year survival rates plummet below 20%. And the demographics are shifting. More young adults are being diagnosed, especially those with long-standing obesity or type 2 diabetes. This is no longer an old man's cancer. It's increasingly affecting people in their 30s, 40s, and 50s. The statistics are grim. In the United States, liver cancer has the fastest growing incidence and mortality rate of any solid tumor, rising by over 40% in the past 2 decades. Globally, liver cancer kills more than 800,000 people per year, often without ever receiving a screening test. Obesity-linked NEFLD is now projected to surpass hepatitis C as the leading cause of liver transplants and liver cancer in the near future. Despite this, liver cancer rarely appears in obesity prevention messaging. Most public health narratives focus on diabetes, heart disease, or stroke, with liver damage treated as a distant consequence or an alcohol-only issue. This gap in messaging leaves millions unaware that their excess weight could be slowly destroying their liver and setting the stage for a cancer diagnosis they never saw coming. Even worse, NEFLD often goes undiagnosed for years. Routine liver function tests can appear normal in early stages, and imaging may not detect subtle steatosis or early fibrosis. Without active screening in obese individuals, NEFLD quietly advances. And once liver cancer is diagnosed, treatment options are grim. Many patients are ineligible for surgery or transplant due to late-stage disease or coexisting obesity-related complications. Healthcare inequities only amplify the crisis. Obese individuals in rural or low-income communities face substantial barriers to specialty liver care, imaging, or advanced diagnostics. Moreover, liver disease is stigmatized, often mistakenly assumed to be self-inflicted through alcohol, leading to delayed treatment and lack of empathy from healthcare providers. Research is urgently needed, but also policy reform. Few clinical trials are studying NEFLD-related liver cancer specifically, and even fewer public health initiatives have addressed the issue head-on. Obesity screening rarely includes liver imaging. Lifestyle interventions are underutilized. The burden is growing, but the response remains fragmented and far too slow. The medical community must reframe NEFLD and liver cancer as metabolic diseases, not just hepatologic or lifestyle anomalies. Liver screening protocols should be incorporated into routine care for anyone with obesity, diabetes, or metabolic syndrome. Education campaigns must confront the outdated image of liver cancer as an alcoholic's disease and show that a sedentary, overweight lifestyle poses a similarly lethal risk. It's time for a wake-up call. Obesity is now a primary cause of liver cancer, and it is driving an epidemic that shows no signs of slowing. If we continue to ignore NEFLD in public health efforts and fail to integrate liver surveillance into obesity care, we will see liver cancer become a leading cause of cancer death, especially in younger adults who have lived their entire lives in obesogenic environments. The threat is real, it is accelerating, and it is largely preventable. But prevention requires acknowledgement. Until obesity-linked liver cancer is treated as the serious, widespread risk it is, millions will remain unaware until it is too late.